Hi, my name is Dr. Rich Hilsden, and you're watching my channel, Knife Skills. Today, I want to talk to you about what you should steal from the hospital during an apocalypse. Lately, maybe over the past 6 months or so, I've been thinking a lot more about an apocalypse, maybe a little too much. If you're like me, you're probably a fan of zombie apocalypse movies. And what makes them special is that they allow us to imagine a society where the norms have been broken down, where the government constraints have been eliminated. Although a zombie apocalypse is not very realistic, it allows us to have an unrealistic fear, an irrational fear, and work through those things in our mind.
Rule number one for surviving Zombieland: cardio.
But as the world gets more complicated, sometimes you think, could an apocalypse actually occur during my lifetime? Could something happen that would break down society norms? And if there were to be an event like that, what would I do? How would I be prepared? You might consider going to a hospital and stealing some supplies. Maybe you need something or think about something that might be useful for medical care in the context of an apocalypse. And that's what this video's really about. What you should steal from the hospital in an apocalypse. Number one, local anesthetics. Local anesthetics are incredibly useful. They block the transmission of sensory nerves and allow you to perform procedures with limited or no pain at all. Many life-saving procedures, such as amputations, can be performed using local anesthetics alone. Life-saving procedures like putting in a chest tube can easily be performed using local anesthetics alone. And so local anesthetics are one of the most useful things that could be stolen from a hospital during an apocalypse. Local anesthetics sometimes include epinephrine, which can allow you to use greater doses safely. And it can also allow there to be procedures performed with less bleeding. It's an incredibly useful adjunct to the local anesthetic. So I would actually look for local anesthetics that include epinephrine within them. Number two, I would choose scalpels and surgical instruments. Doctors really aren't useful without tools, and certainly not a surgeon. You need to have scalpels to do the most basic surgical procedures, and having surgical instruments like forceps, which is the medical term for tweezers, would be incredibly useful in a zombie apocalypse. Number three would be antibiotics. During an apocalypse, I can't imagine there being enough antibiotics to go around. With trauma happening, with the loss of hygiene, the number of infections would increase dramatically, and antibiotics would be incredibly useful during an apocalypse. Because a lot of these infections would be related to our environment and would be coming from the skin injuries, I would try to find antibiotics that were based on penicillins that could treat those gram-positive organisms. They would be incredibly useful in an apocalypse. Number four would be systemic anesthetics. So I mentioned how local anesthetics would be one of the most important things to get in a zombie apocalypse, but let's not forget that some things are best done during a general anesthetic. Now, systemic anesthetics are tricky because they can lower your blood pressure, they need monitoring to be used properly, that are incredibly difficult to use. But there is one systemic anesthetic that would be incredibly useful in the context of a zombie apocalypse, and that is ketamine. Those of you may be familiar with ketamine. There is this concept of the K-hole where someone is completely unconscious and separated from their body. Ketamine is special because it doesn't lower the blood pressure in most people, and it doesn't suppress the respiratory rate. This allows you to do intensive cavitary procedures on someone, and it requires much less monitoring to be safe. So if I were to raid the hospital, I would be looking for ketamine. Number five, we'd want to use antiseptics. Now, antiseptics is a weird one because if you remember as a kid, maybe your mother would use alcohol rubbing solution to clean a wound and it'd burn and it'd be really uncomfortable. Well, we've learned that actually that type of cleaning a wound isn't any better than using water alone. In fact, those antiseptics might damage tissue more and be actually harmful. However, in an apocalypse, they would be very useful. The reason why those don't work very well is because compared to clean water is a better solution to clean wounds. The problem is that in an apocalypse, there'd be an incredible shortage of clean and safe water. And you wouldn't know if you're actually adding bacteria to the wound if you were to try to wash it with water that you acquired during an apocalypse. The thing about these antiseptic solutions, they have a high amount of alcohol. They would have very low, if any, bacteria in them at all. And therefore you'd actually be using a true sterile solution to clean a wound. It's the sterility of those solutions that has the value rather than the alcohol alone.
They're coming to get you, Barbara.
Lastly, you should be stealing bandages from the hospital. Trauma is going to be the major problem in a post-apocalyptic world, and injuries will need to be protected from the environment. By covering a wound, you prevent bacteria and dirt from the environment from getting into the wound and contaminating it. So I think bandages would be an incredibly useful thing to bring from the hospital.
This lady here is getting chased by the dumbest Z there is, what we call a homer. In a world without YouTube, who wasn't entertained by a homer?
Finally, some bonus points. So what to look for if you are raiding the hospital? Well, one thing I would recommend is look for single-use drugs. There are multi-use vials, single-use vials, and one of the advantages of the single-use vial is that typically the dose within the single-use vial is meant to not overdose the average person. They put only the amount needed to do the desired effect and not more. So that would be my bonus recommendation for you if you are going to raid the hospital during an apocalypse. Let's hope apocalypse never actually happens, but it is on my mind. And I'm curious if you're watching this video, if you have any other ideas of things that you could raid during an apocalypse. If you're a professional in another field, let's say law enforcement, what would you recommend people raid from a police department during an apocalypse? My name is Dr. Rich Hilsden. This is Knife Skills, and thank you once again for watching.